In the old days, it seemed as though if you were missing a tooth or needed to have a tooth taken out, the only way to replace it was something removable like a denture or maybe a bridge or something like that. Nowadays, with the technology that we have and the training that myself and my team have, we're able to now take that missing tooth or that missing space and able to place an implant in there that looks and functions and feels like a natural tooth. Implants are by far the best option, whether you're missing one tooth. In some cases, when you're missing all your teeth and you already have dentures, we can place implants underneath those dentures to secure those dentures even better. A lot of people are having issues with their dentures, whether they're loose, they're afraid they're going to fall out, they're afraid that they can't eat properly, that they can't chew properly. For them to come in here and get implants in, it's like night and day. They're able to look better, they're able to feel better, they're able to have more confidence in the way that they chew, the way that they smile. It's just a game changer for them. The fact that we have sedation options just makes the process all the better. We can go ahead and put the patient to sleep, and the patient doesn't even know what happened the next day. All they know is that their teeth are back in their mouth and they're feeling as good as new.